incontinence, that's the topic where I'm going to talk about today. Incontinence, yeah, the pee and poo of the society. But in a toilet, but not in a toilet, in your pants, in your bed, somewhere, everywhere. But I'm going to talk about incontinence in the elderly care sector. Why in the elderly care sector? Well, I will explain it to you by the cycle of life. When we came on Earth, we are very cute when you look at the picture, and our parents care about us, and it's really funny to touch children. It's almost a pleasure to change the diapers of the children. But then we became old, ugly, most of us, and it's not very funny anymore to touch that kind of people, to change diapers of such kind of people, because yeah, the voidings become bigger, they are a little bit less funny to touch, their weight is much higher, so yeah, there are a lot of problems regarding changing diapers with elderly. So, and that's the reason why most home caregivers transfer their parents, their grandparents, to elderly care homes instead of taking care of them at home when they became incontinent. And yeah, you can say incontinence, it's a far from your bed show. It's actually not that true. So because 33% of the people which are older than 65 are incontinent. So please take a look to your left and your right neighbor, and if none of them is incontinent within now and 40, 50 years, you are the one who is incontinent. So it's not a far from your bed show, it's closer than you think. So let's take a closer look at how the current situation is regarding caregivers inside an elderly care home. So this is the cycle of 24 hours, how the nurse is going to check if a diaper has to be changed or not. And what we see over there is that the nurse is checking the diapers around 5 times a day and around 3 times a night. So how does it go? She enters the room, and with some patients she asks, is there a change needed, yes or no? And with other patients, for example with dementia, they are not very good in giving correct answers. They are just checked by removing the bed sheets, removing the pants, wrestling a little bit with the patient, and then she has to remove also the diaper to look if something is present inside the diaper or not. So it's a really labor-intensive task for the caregivers. So they want to do a good job, but it's so labor-intensive. And of course, during the night, the elderly are waked up 3 times. So I don't know how you feel when you are waked up 3 times a night, but I'm not a happy person then. So, but as you can see, you have around 8 diaper checks a day. So you have sometimes a time period of around 3-4 hours that, the nurse is not looking to the diaper. So what happens if somebody is losing something a quarter after a diaper change? During my internship in an elderly care home, a woman has produced a stool inside her diaper a quarter after a diaper change. And she was lying over there for more than 3 hours till the nurse came in at a fixed moment to check the diaper. And I was asking to that woman, why haven't you alerted the nurses? Why were you lying over there in your own smell, in your own stool? And the woman told me, well, have you seen the face of the nurse when she came into the room and changed my diaper? So the women prefer to lie in her own stool for more than 3 hours in her own smell because she was so embarrassed about the fact that she doesn't have the totally control over her body. And that's a really big interhuman problem that we want to solve by means of technology. But this is just to say that the current situation is not optimized. And further regarding that, there is also a problem with the caregiving in general, because it is not monitored in a good way. So this is an example of a woman which is more than 90 years old, and she was crying, screaming, just for help more than 300 times in a time frame of 2 hours. And nobody was answering her from the nurses. This just to say that you cannot ignore the fact that in elderly care homes everything goes well. So if you put your elderly persons inside an elderly care home, you still are responsible for them. But we also have good news today, because we have some solutions. I'm an engineer, and we are developing sensors for diaper purposes, which can detect several voidings inside diapers. So this kind of sensors are measuring actually the voidings of the persons, and those data is transferred by means of wireless connection towards the nurses. So how does it look like in practice? So a person has an unwanted voiding, the sensors are measuring the voiding, and it is wirelessly transferred towards the nurses, which are going to do an intervention. This is not an alarm system, so there will not be a very harsh thing that is going to happen, but it will say to the nurse, please change the diaper within now and half an hour or 2 hours, in a way that you avoid skin irritations and so on. So if we look to the conclusion, we can change the world of incontinence care, but I'm not going to do it on my own. So I'm going to help you with means of technology, but we need to break the taboos about incontinence care. We need to say that it is not optimized yet. We have to help the elderly. We need to give them respect. So, because they are worth it, the elderly are worth it, the caregivers are worth it, the environment is worth it, and especially you are worth it, because you are the incontinent people of tomorrow. Thanks.